Is it normal to only give Botox to the top half of the forehead? I recently got Botox for my deep horizontal lines. The doctor said he had to leave 2 inches above my eyebrows so that I wouldn't get a heavy brow, since I have a prominent brow and expressive face. He said I would not be very unhappy with the results, and my eyelids could droop and feel heavy. I respect that he could have just done it, but didn't. I'm curious if I should get a second opinion. I just can't believe I'll never get rid of these wrinkles. And for all that money, feeling defeated.
Thank you for your question. You submitted a single photo and you're asking, is it normal to place Botox only to the upper part of the forehead? And you describe in your question a recounting of the dialogue that you had with your doctor, who stated that they would leave about 2 inches above your brow with the areas that were injected so that to avoid you losing full expression, as well as to avoid downward drop of the brows, which would then cause your eyelids to be heavy. And it seems that you're still dissatisfied and you feel, quote, defeated after spending all the money you spent. Well, I can certainly share with you how I have this discussion with my patients about similar situations like yourself, which are actually fairly common. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I've been treating patients with Botox since 1993. So I think that one of the challenges that we had to deal with up to this day has been dealing with patients who got overtreated. And when I say overtreated, I mean basically well-meaning doctors who want to treat the wrinkles across the forehead, and by doing so eliminate the mechanism by which the eyebrows can be elevated, which is used to help reduce the heaviness of the upper eyelids on the eyelid itself. You see, when we look at horizontal lines on the forehead, there's a question that first comes to mind: is why are those lines relatively deep? Very commonly, beyond a certain age, it's because unconsciously people are raising their eyebrows because of the soft tissue descent of their eyebrows, the amount of skin that is weighing down on their eyelids. So they're unconsciously keeping their brows up so that they can actually see better. And of course, when they look in the mirror and they see those lines, they're distressed by those lines. So doctors will typically, or as I would do in my practice, is I will have them look straight and relax their forehead. And when their forehead is relaxed and I take their pictures, I'll show them that there's so much extra skin over their eyes. And so then we discuss other options in addition to the Botox. The Botox can be done in a variety of manners to maintain some degree of tone so that you maintain the ability to raise your eyebrows, both for the sake of a natural expression as well as for the ability to prevent the full cascading of the skin over your eyelids. Now, very often, once people realize that they have all this extra skin over their eyes, then we have a discussion of different brow lifting options as well as upper eyelid cosmetic surgery. What's really nice is that when people are aware of the fullness and heaviness of the skin over their eyes, well, a procedure like cosmetic upper eyelid blepharoplasty, which we do pretty much every day in our practice under local anesthesia with light sedation in our office, Joint Commission approved facility, we're able to actually reduce the amount of wrinkles in the forehead by diminishing the habit, or actually eventually extinguishing the habit, because they don't have the weight over their eyes. Now, interestingly, it still does take some Botox to extinguish a habit. Very often people still raise their eyebrows even after eyelid surgery, so it's not 100% immediate. But once they're able to relax their forehead and they don't have to work so hard, then the schedule for Botox can change. And they don't often need as much. Maybe they need a little bit just to kind of maintain a nice natural look, but not as much to avoid the deep wrinkling of the forehead, which comes from continuous, constant contraction. Not to mention that they also get fatigued from raising their eyebrows consistently. It's like holding a weight up with any muscle. You can only do it for so long before you get fatigued. As far as your doctor's approach, I certainly would say that it is a valid approach, and I think your doctor was certainly being thoughtful in explaining what the basis was to help you achieve a natural result. Now, there is certainly pluses and minuses to being aggressive, but I would say that once somebody is unable to move their forehead or feels like their eyebrows are too low and their eyelids are heavy, they'll describe like feeling trapped, and they're very, very distressed and very unhappy. So life is about compromise, and you do have to kind of figure out with your doctor what you're willing to tolerate. But a lot of times in clinical medicine, it's treat and observe, so you can see what kind of result you have. Now you can also compare your before and after. Compare the wrinkle. I always take pictures of muscles under activity and then relaxed, and I show my patients how they look even after something as minor as getting Botox done. Because it is very important to understand the activity of the muscles and how they were diminished. And I always explain to my patients the definition of success is improvement. We can't eliminate everything with just a needle. And you have to decide what you're comfortable with and what you're ready to do, whether it's now or later on. My patients tend to stay with me for a long time, and so we may do Botox for the important event, but then later on, a year later, 6 months later, whatever, we'll do some surgery to help address the underlying issues, such as in a scenario like this, where hooding over the eyelids causes a reflex of raising the eyebrows, which therefore leads to wrinkling. So you treat the underlying cause, you can diminish the wrinkling more in a long-term way with a strategy in mind. So I hope that was helpful. I wish you the best of luck, and thank you for your question.